Hello, everyone, and welcome to the Power of Thyroid Health. I'm Dr. Lulu, and I will be your host this evening for our amazing webinar. One of my most favorite topics to talk about is the thyroid. One of the reasons is because I think there's a lot of misknowns and question marks about how to improve thyroid health. So welcome to the Power of Thyroid Health. I'm really excited for this webinar tonight. And one of the things I want to mention, even before we get started, which I'm going to introduce myself, is just this picture. And so a lot of thyroid health has to do with the way, especially with women, how we've been suppressed and not able to communicate from our throat and our throat center. So this image is really valuable because it shows the strength that we can have coming together as women, and also the knowledge and power of learning about the thyroid and how we can be empowered. So that's kind of like the reasoning behind this picture, which I find really important. Okay, so here's me. I'm Dr. Lulu Shimek. I am a naturopathic physician and functional medicine practitioner. I'm an author, botanical formulator, and podcast host of my own podcast, The Genetic Genius, which is a fabulous podcast. It comes out once a week. And if you're looking for some really interesting ways of alternative health and other things off the radar, it's a great podcast to listen to. So I highly recommend it. So I really focus and work with patients who are experiencing chronic disease, hormonal imbalance, endocrine disorders, just like the thyroid, and gastrointestinal dysfunction like leaky gut, depression, anxiety, and a fatigue. I specialize in adrenal fatigue and work a lot with women, empowering them to take charge of their own health and rediscover that energy that has been lost along their route of or their journey of chronic illness. So I really believe that once we dive deep down into the root of the problem of the distortion of disease, and then we can ignite our own body's ability and innate ability to heal, we can see unimaginable changes in our well-being. So it's really about us taking charge of our own health. And my passion lies in helping people discover their zest and joy for life that's been lost along their path of illness. And before starting my clinic, Dr. Lulu's Naturopathic Clinic, I had a larger clinic last year in 2020 in downtown Asheville. I had an integrative clinic of 18 practitioners. And when COVID started, I had to close that clinic. And so now I'm just functioning solo and seeing patients via telemedicine and teaching and educating. And that's been a great transition for me. I journeyed through many careers as a true Renaissance woman. I studied interior design. I love art and drawing and fabric design and ceramics. I have a doctorate from the prestigious Bastyr University in Seattle, Washington. And like I mentioned, I love plants. I work at the Veterans Healing Farm, where I work with that community, teaching them about botanical medicine and how to work with plants to enrich their lives. I'm also an international speaker. I speak at conferences and summits all over the world. I have one that's coming up in 2 weeks. If you're interested in joining, it's free. You can just check it out on my Instagram. I just posted about it today. So check that one out. It's all about being your most fantastic self. So I'm really stoked about that. So I also have a new amazing book out, and I just want to show that to you here. Okay, this is my new book. So proud of it. It's called Detox, Nourish, Activate Plant and Vibrational Medicine for Energy, Mood, and Love. It focuses on the three main organs, the adrenal system, the brain, and the heart. And then, like I mentioned, my podcast is all about alternative health. So that's a great way to kind of connect in and learn about different ways about your health in a wonderful free way and spread it around the world. That's my intention with that, is for people all around the world to learn about health. So one last thing is I facilitate ceremonies to activate plant and mineral medicine, connecting points around the world to help the planet heal and elevate planetary consciousness and connect community. And I'm the botanical medicine director out at the Veterans Healing Farm in Hendersonville, North Carolina. And I share my expertise and knowledge with that community, with the veterans, helping teaching classes there and running the community clinic and the medicinal garden. So that's a little bit, just a little bit about me, but let's dive in. So today we're going to be talking about how to empower the thyroid. We're going to be talking about what specific labs to do, what supplements you can take and use. And then also I'll be giving and sharing lots of different tools you can use after the webinar to empower your health. Okay, great. So what are we going to be talking about in this workshop? So one, why women are at an increased risk for thyroid disorders. This is really important. How reproductive hormones, gut health, and toxins affect your thyroid health. And then 6 potential triggers or stressors that affect your thyroid. So Thyroid Health 101, let's dive deep down. First, we're going to go over those foundations of thyroid, because it's always good to first connect with the organ, learn about the organ and its function, because it helps us to connect to that physical aspect of our body. So first of all, where is the thyroid gland? It's in the throat. The thyroid gland is an endocrine gland that is in your neck just below the Adam's apple. It has a butterfly shape and it's made up of 2 lobes, one on the right and one on the left. And each lobe lies on either side of the trachea or windpipe. So what does the thyroid gland do, right? It really has a lot of functions, but essentially it secretes 2 essential thyroid hormones that help the body cells to function correctly. And the first hormone is called thyroxine, or T4 for short. And the second one is called triiodothyronine, or T3 for short. And the anterior pituitary gland, which is above the thyroid in the brain, then tells the thyroid what to do by releasing TSH, thyroid stimulating hormone. So those are the 3 kind of main hormones that are connected to the thyroid gland. So thyroid hormones are needed for nearly every cell in the body. It's a very, 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 I can't emphasize how important the thyroid gland is. And I think this is one of the reasons, just one, that we're seeing, we're really, I would say we're on an epidemic of thyroid dysfunction in women, and it's not talked about enough. And, it's really common for women to go in and they say, oh, I'm having some fatigue and my cycle's not functioning well. And then boom, they're given a medication to balance the thyroid. And then the thyroid never works the same again, because it's given something to tell it that it shouldn't be working the way it should. So, first of all, let's get into a place of empowerment where we are able to take charge of our own health. And then let's find out about what the thyroid's doing, so we can clue in about when these things start to go out of balance. These are some things that are going on. Great. Welcome. Christy just tuned in from Scotland. I'm so happy to have you here. And I'm going to be talking about some issues with the hypothyroidism and with hyperthyroidism today. So you're going to be learning about that. Okay. Whoops. So thyroid hormones affect every cell in the body. So energy levels, weight gain, weight loss, hypo or hyperthyroidism, mood. We can have a lot of anxiety and or depression related to the thyroid gland. Metabolism. This is very common. People know about metabolism in relationship to the thyroid gland, but did you know that you can have weight gain and or weight loss? So one of the reasons, or one of the things I hear a lot from patients and clients is that, okay, I have done everything and I can't get my weight to shift. And, even if they've already been diagnosed with hypothyroidism, it still won't budge. And that's because they're not doing the right proactive things. But metabolism is a huge part of our thyroid gland. Cognitive function, brain fog, memory, really connected a lot to the thyroid gland. Periods, so heavy periods, PCOS, how our cycle goes as we move through as women into perimenopause and menopause, and even pregnancy. So you can see just from those few things that the thyroid impacts so much in our system. And from the energetic level, like I mentioned, the thyroid is all about the 5th chakra, which is right in the throat. And it's all about communication, how we voice our truth, how we communicate to the world. So it's really important that we have a strong and functioning thyroid gland so that we can speak our truth. So common thyroid disorders. So here are just a few of the common things that are associated with the thyroid gland when it starts to dysfunction. So one is Graves' disease. This is an autoimmune condition that causes hyperthyroidism or overactivity of the thyroid. And so that's Graves' disease. And sometimes it'll even go so far down the road that then the thyroid will be removed. So that's can be a dangerous one for the system. And so that's sometimes why the thyroid gland will be removed. But that's a huge, can you just think about that for a moment? If you have Graves' disease, or if you're here and you have it, we just mentioned everything that's involved here with the thyroid gland. So if we take out that gland, what happens to those other functions in the body? Okay, Hashimoto's thyroiditis. This is an autoimmune condition that causes hypothyroidism or underactivity of the thyroid gland. Thyroid eye disease. So this affects people with hyperthyroidism as a result of Graves' disease. This is, you'll see kind of like a bulging of the eye socket or the eyes themselves. So nodules, these are actual growths on the thyroid gland that affect how the thyroid gland works. And sometimes it can be even so enlarged, it'll be visually active or palpable, meaning you can feel it in the throat. Thyroid cancer, this is a rare type of cancer that can affect the thyroid. And then postpartum thyroiditis. So this is when a thyroid disorder occurs in women who have just had a baby, often temporary, but can return in every subsequent birth. And that really needs to be managed with a physician to get you back on track. Okay, let's talk about women and thyroid disease. Now, I mentioned kind of that already, but let's talk about we as women, or if you're a man and you're visiting our webinar today, welcome. It's not just for women, but I'm gearing this towards women today because it's an important aspect of women's health. So women are at an increased risk for thyroid disease. Women are at 5 to 10 times more likely to be diagnosed with a thyroid in men. There are a lot of missed diagnoses, so that number is actually a lot higher. It's estimated that millions of women are suffering from symptoms of thyroid disease and don't know it. Okay, so that's huge. And that's why the quiz that I'm going to send out, in case you tuned in and you came in a little bit late, I mentioned at the beginning that I'm going to send out a quiz post webinar tomorrow. And I want you to take that quiz and just, if you have a lot of those symptoms, you'll see, I'll show it to you this evening. If you have all of those things come up and you haven't been diagnosed, if you're wondering if you have something going on with your thyroid, or maybe you've been having treatment and it's not working, this is a time to really dive in deeper to figure out why. Okay, so signs your thyroid may be in trouble, right? These are basically like red flags and alarms that your body sends you, say, hello, things are not going right. So these are the most common. There are other items or other things, especially as I mentioned, if the other cells of the body are out of balance that are being caused by dysfunction of the thyroid. So one, people feeling cold when other people do not. That's very common. Chronic constipation or loose stools. The gut is highly connected with the thyroid gland, especially autoimmune diseases of the thyroid. It's highly correlated and studied with the connection of celiac disease. So we see a lot of connection with the gut, which I'm going to talk about later today. Muscle weakness, muscle pain, or joint pain. Now that's kind of a vague symptom, right? It can be connected to many other things, but we're looking at things kind of like as a whole, and then multiple things that might be going wrong. So unintended weight loss or weight gain, feeling sad or depressed, the mood is highly connected to the thyroid gland, exhaustion or nervousness, rapid heartbeat or slow heart rate, dry skin, dry and thinning hair, very common symptom to have hair loss or alopecia, a hoarse voice. And this is because the thyroid gland will become enlarged, which then blocks our vocal cords. So that is a really easy, common symptom that something is going on with the thyroid, people will notice that more, like, oh, I've had this change in my voice, and attached with these other symptoms, that's a big red flag or big key that something's happening. Menstrual irregularities, like I mentioned, a swollen neck and hard to swallow, again, in that same area, and feeling nodules on or over the thyroid. So all of these, and you can see there's lots of different things here that can be connected to problems with the thyroid gland. And there's lots of other ones that will be in conjunction. For instance, high cholesterol is also really common because, like if you saw before when in the screen before, let's go back to that. Do you remember how I mentioned metabolism right here? So metabolism is all a part of our cholesterol because metabolism of the thyroid affects our liver. Our liver makes cholesterol. So that's going to be a big one with thyroid disorders, is cholesterol imbalance. Okay, so let's talk about here what causes thyroid disease. Like, okay, well, either like you're thinking maybe I have some thyroid issues going on. Maybe you've already been diagnosed, but you can't figure out how to get better. But why? What happened, right? That's the detective, and part of me is the doctor. I'm always thinking like, okay, well, what happened here? Why did you get this problem with your thyroid in the first place? So many factors are involved in the development of thyroid disorders, many of which are out of our control. And this includes genetics. While we can't change our genetics, supposedly, right? I actually think that that's not 100% true. I think that there's some genetics, and that's a longer conversation webinar. I should do one about genetics coming up. I will. But we can't necessarily change every aspect of our genetics. I guess that's a better way to say that. Genetic predisposition alone is not enough, right? There must be a trigger that turns the genes on or off to send the signal to the thyroid that it's functioning or not functioning. Triggers or stressors vary from person to person, right? Depending on those genes and also how we're made up as an individual, how we handle stress. Making a universal approach to treatment tricky. So that's what, when it comes to the thyroid, there are lots of different ways we have to look at treatment. And of course, with all things an individual, right? It's all an individual basis. Well, that's how naturopathic medicine is, and functional medicine. We look at the individual and how they're doing, what specific individual treatment do they need that's different than the next person. Today, we'll look at 6 common triggers or stressors that affect how your thyroid functions. Okay. All right. So should I get tested? This is like question number 1. This is what patients ask me all the time. Well, should I test my thyroid? I've already been tested for my TSH. My TSH is normal. Are there other things that I should test that will show that my thyroid is out of balance? Well, the question there is totally. There are lots of different tests and labs, and I'm going to go over those. And I'm also going to send out my lab reference sheet that you can use either when working with me or taking to another doctor, your primary care physician, and saying, hey, these are other labs, or you can also order them on your own. I've given you some references there if you're feeling you're not getting the results from the current physician you're working with. Okay, so if you've been experiencing several symptoms from that slide before, or like you're going to take the quiz later and you're going to say like, oh, I'm really experiencing a lot of these things here, maybe I should get tested. However, the problem with hypothyroidism, so that's when the thyroid is not functioning properly, and that it's underactive basically, is that its symptoms are broad and overlap with many other conditions. So you may get tested and have definite results before you start any thyroid, or you must get tested and have definite results before you start any thyroid medication. So that would be a thyroid medication. That would be a prescription, right? So levothyroxine, for instance, or taking thyroid medication without having a thyroid problem could be as harmful as not taking it if you do. So taking a test is really good. We don't want to guess about our thyroid. We want to know for sure if it's working or not working. Okay, so these are my go-to tests that I really recommend for laboratory assessment. And like I said, I'm going to give you and send out a reference sheet with links that you can order some of these on your own if you're not working with a physician. But I really recommend, again, before you're starting any type of treatment, that you do these tests. Okay, so here you go. So they're listed kind of in order of how I test. So first we have the thyroid hormones. Those are basically all in that first row there. So you have TSH, thyroid stimulating hormone. And let's first talk about thyroid hormones and antibodies. So first, like, thyroid disease can run in families, and it's often, you'll see it in the female lineage through the line, the grandmother, the mother, the sister, the aunt. It's common because it's in that genetic makeup. And it's advised to evaluate your thyroid hormones. And also, if you have other family, if you are tested positive for a thyroid imbalance, that you might recommend that if one of your other family members is experiencing some of these same symptoms, they might be tested or need to be tested as well. So along with the standard thyroid testing, which is really just this one in the corner, TSH, that's the only standard thyroid test that is on with a typical MD allopathic model, which you can see that's very different. Then we're looking at a lot of different things here. So I recommend also testing your sex hormones and all of your thyroid hormones here as well. And so let's talk about these here. So, and again, one other thing here you'll see on the second row is thyroid peroxidase antibody, as well as thyroglobulin antibody. These are antibodies. So why do we test? First of all, why do we test the ones in the first row? TSH, free T4, free T3, total T3, whoops, sorry. And reverse T3. So those TSH tests the way the anterior pituitary gland in the brain is communicating to the thyroid gland and telling it what to do, whether the thyroid is overworking or not working enough. Then the thyroid is a feedback loop system. The thyroid communicates back to the anterior pituitary gland with free T4, free T3, total T3, and reverse T3, telling the thyroid or the anteropituitary gland, hey, I'm working well. No, I'm not working. So then it's this constant feedback loop that happens. So we want to make sure that we're not just testing TSH. That's not enough. We have to test all the other aspects of the thyroid and a full thyroid panel. And we have to test the antibodies because we want to make sure there's not an autoimmune disease like Graves or Hashimoto is happening. So many conventional doctors do not order thyroid antibodies tests. And this is a big piece that's being missed in the autoimmune aspect of thyroid condition. When I have a patient come in who's seeing me and is just so frustrated because they're having thyroid problems and nothing's shifting, nothing's changing. And I look at their labs and like, the only thing that's ever been run is TSH. How can we tell how your thyroid's functioning? Do you have an autoimmune disease? That treatment is very different for an individual as opposed to someone who doesn't have an autoimmune disease. So it's really important. So TSH, again, stands for thyroid stimulating hormone. And this is an important pituitary hormone coming from the anterior pituitary gland that is secreted in response to the level of thyroid hormone present in the blood. So TSH is measured to check how well the thyroid gland is functioning and to detect thyroid disorders before symptoms are evident. Just as a side note, I think it was in the year 2000, I put this in your handout too. I think it was here. Yeah. In the early year 2000, the American Association of the Clinical Endocrinologists recommended that the thyroid lab references should be narrower. However, many laboratories and doctors have not yet updated their practices to reflect this recommendation. So right now we have a very broad scale of how the thyroid is functioning, and someone will go in and get tested like, oh, well, your thyroid levels are normal, you're fine. And said, but I don't feel fine, right? And so that is one of the reasons why was there really, so I always like to see numbers, especially if someone has autoimmune disease, that TSH level is between 2 and 2.5. That's like the sweet spot where they're functioning and feeling great. Okay, free T4, this is thyroxine. The thyroid gland produces a hormone known as thyroxine, which is also called T4. So free T4 measures the amount of T3 that is not bound, so they're bound together to proteins and available for use. So what that means is the free T4 is evaluated to assess the thyroid function itself and diagnose thyroid disease, including hypo and hyperthyroidism. So now we have free T3. So free T3 is triiodothyronine, and the T3 hormone, this is the amount of T3 that is not bound to proteins and available for use. So free T3 is typically evaluated to help diagnose hyperthyroidism or to help monitor treatment of thyroid disease. Okay, so then we have our thyroid antibodies. These are in the next row here. Okay, so we have thyroglobulin antibody, and this is TGAB for short. This is used to evaluate blood levels of antibodies the body has made against thyroglobulin. And this test is generally ordered to determine the cause of the thyroid disease. And then TPO, which is this one here in the first box or the second box, thyroid peroxidase antibody. This is an enzyme normally found in the thyroid gland, and a TPO test detects antibodies against TPO in the blood. And again, this has helped to determine thyroid disease. So those are two antibodies that are used for determining antibody and autoimmune function. So stress hormones, I always recommend running a cortisol, and I actually didn't put that on the screen here, but cortisol is important. This is our stress hormone. It's most commonly known as the stress hormone. The adrenal glands release it upon signals from the HPA axis, which is the hypopituitary adrenal axis. And like I just mentioned, the pituitary gland in the brain is signaling to the thyroid in times of stress and also to the adrenal gland. So it's very important to get that tested. So gut testing. So zonulin is a super important test. Zonulin regulates that Z-O-N-U-L-I-N, zonulin. This regulates the size of the openings between the intestinal lining and the bloodstream. So this is all about leaky gut. So we have the cells, and the cells attached together like in a big tight junction. And when those become loose in leaky gut, we can see that there's a problem with, it could be with gluten, with parasites, candida, harmful bacteria, that zonulin levels rise, and then the thyroid can be affected. So also here's some other things I recommend: iron studies with ferritin, zinc, selenium, and vitamin D, super important for hormone regulation and immunity. Vitamin A, iodine, a really important factor of how the thyroid itself functions. A celiac panel, like I mentioned, especially if you have an autoimmune disease. Hashimoto's, I always run a celiac panel just to make sure there's not celiac issues going on in the gut. Food sensitivities, or an IgG food map. So there's lots of foods or food sensitivities that can be associated with the thyroid gland. So really important to have that tested. Toxic minerals. So this can be a detox test, a test for heavy metals, Epstein-Barr virus, EBV, and then also the MTHFR DNA test. So this helps MTHFR, or methylene tetrahydrofolate reductase. That's why we say MTHFR for short, helps the body break down a substance called homocysteine. And homocysteine is a type of amino acid the body uses to make proteins. And typically, the folic acid and other B vitamins break down homocysteine and change it into other substances the body needs. So I always test this because I want to see if you have any methylation problems, how the thyroid is functioning, how are you responding to stress and anxiety. So these are just a few, right? You can see there's lots of different aspects that we test that I recommend to test in relationship to your thyroid. Okay, let's talk about reproductive hormones. And I mentioned these earlier as an important part of testing for thyroid. So estrogen, so the connection between estrogen and thyroid health is really hard to ignore, right? It's part of us, females especially, and men. It's part of our reproductive makeup. And when you consider that women are 8 to 10 times more likely than men to be diagnosed with a thyroid condition, we also need to look at the estrogen, testosterone, and progesterone. Women are also at increased risk of thyroid problems during transitionary times, such as pregnancy, postpartum, menopause, a huge aspect, women 40 and up. Not that women are in menopause at 40, but some are. And we want in that perimenopausal phase, we want to be supporting all of the hormones in the reproductive cycle, implementing sex hormones in the development of thyroid conditions. So that's estrogen. And then we also have progesterone. So a progesterone deficiency is another common hormone imbalance. If progesterone levels are consistently low, this leads to relative estrogen dominance. And if you're estrogen dominant, your thyroid hormones get bound up by thyroxine binding globulin, or TBG. And this reduces the number of available thyroid hormones, resulting in symptoms of hypothyroidism, even if you make enough thyroid hormones. That's really key, right? Okay, and then hormone balance. Okay, so we don't have enough time today to discuss all the ways to keep estrogen and progesterone balanced, but I have lots of great info. If you're looking for more of my wellness webinars, they're on my website and on my YouTube channel, and that you can go to learn straight on my website at doclulu.com. And there's lots of different webinars there. And I'm moving into this huge phase now of really transitioning into focusing on thyroid, adrenal, and hormones. So there's going to be a lot more. And estrogen dominance is next week. So if that's I think it is next week. Estrogen dominance is next week. So if you're wanting more information about that, make sure to tune in. Okay, so I do want to make sure to mention that birth control medication does not balance hormones. Okay, so that's really key. While synthetic hormone medications such as birth control pills and estrogen are often prescribed with the promise of balancing hormones, they don't balance anything. They suppress hormones, and when they are stopped, it just results in a total hormone chaos. And I have many patients who are on birth control medication for many, many, many years, and they have a lot of problems, especially going into menopause. Okay, let's talk about stress. Stress is a huge factor that affects the thyroid gland. So stress, while stress alone has not been shown to cause thyroid disease, so to speak, it is a trigger or stressor and will affect the way your thyroid functions. So high stress levels slow down thyroid function, right? We want to slow down everything, resulting in the reduction of T3 and T4. Remember, those are the hormones I mentioned that the thyroid actually produces. And thyroid hormone imbalance, so TSH imbalance, causes stress, creating a huge vicious cycle of that feedback loop. So, it's a really important thing to do to test the cortisol levels, like I mentioned before. Okay, let's talk about some ways to de-stress. So finding ways to de-stress, such as exercise, meditation, practicing self-care. Practicing self-care, you may significantly improve your thyroid health. So I want to really emphasize this. If you're having a lot of thyroid problems now, or you're thinking that you are, bring in that mindfulness component. And again, I'm plugging my website. I have a lot of mindfulness tools as well as meditations on my YouTube channel. And so you'll also see a dramatic improvement in your overall well-being. Of course, right? As that we de-stress, everything is affected by stress. Our immune system, our adrenal system, our inflammatory system, everything is affected by stress, sleep, hormones. So when we de-stress, our whole body feels the results. So start prioritizing yourself and treat your downtime with as much importance as your work commitments, right? I have to schedule in my time for working out. I put it in my calendar. I put in my supplements. I put in my water. I put in my meditation, because for me, if it's in my calendar, I will do it. Okay, let's talk about gut health. So a lot of times people don't think about the gut as being connected to the thyroid, maybe just in that metabolism piece, right? Like, oh, I'm gaining weight or I'm losing weight. What's going on? So let's talk about this component. So the gut thyroid connection. So the gut thyroid relationship is perhaps the most overlooked aspect of the thyroid health, really under evaluated. Without a healthy gut, you won't get far with balancing your hormones, your thyroid hormones and your hormones. There is a microbe population in the gut, a microbe population that aids in converting your inactive thyroid hormones to active. Did you know that? That is the key. If you learn one thing from this lecture, I'm sure you're learning more than one thing, but if you're learning one thing from this wellness webinar tonight, learn that if your gut is not happy, if you're having gut dysfunction, bloating, gas, diarrhea, food in your stool, any of those things, that your thyroid is not functioning properly. And that's a huge piece to be addressed. So symptoms such as belly bloat, weight gain, difficult periods, and skin issues can be signs that your gut is compromised and your hormone conversion is not what it should be. So when you don't have enough active thyroid hormone, right, that active piece, this leads to symptoms like weight gain and fatigue. So a lot of times patients will come in and say, I just can't get the weight to budge. I can do everything. Nothing happens. And I'm like, well, let's look at your gut health and your thyroid connection. Okay, let's talk about how to give your gut a boost, right? So I just said, okay, well, your thyroid is really connected to the gut. Well, how do I do that, Dr. Lulu? So watching what you eat can go a long way in improving your gut and boosting your thyroid hormone conversion. So eating organic and eating a balanced diet, that's really just a start, like the whipped cream or the cherry on top, right? So consider adding sauerkraut, kimchi, cultured root veggies, traditional pickles, fermented vegetables, and unpasteurized miso into your diet. These are some things you can start doing right away to help improve your gut health. Also taking probiotics and enzymes. Those are also great additions too. Consume only homemade or real cultured food from the refrigerator section of your store or make it yourself. We have some wonderful local companies here that make fermented vegetables. So I'm really blessed for that. And I'm very grateful. But if you don't have that where you live, find some that you can get shipped to you that are refrigerated or learn how to make your own. Most of the products sold on the store shelf are made with a vinegar brine and do not have the same health benefits. So make sure you're checking the ingredients there. Okay, let's talk about nutrition and the thyroid gland and thyroid health. So how nutrition affects the thyroid, or how does nutrition affect the thyroid? So diet and nutrition has tremendous potential as a trigger or stressor in most all health conditions. So too many calories or too few calories or foods that mess with blood sugar, alcohol, processed foods, and even some of the healthy foods, if we are reactive to them, right? If we have a food sensitivity or food intolerance, we have an inflammatory reaction that can mess with thyroid function. So while it's okay to have an occasional indulgence, focus on eating real food, shopping the outside aisles of the store, and learning about foods that are supportive for the thyroid gland. So let me show you what that looks like. So eat this. So healthy fats, grass-fed butter or ghee, organic free-range eggs, omnivore fats from pasteurized raised animals, raw and unrefined coconut oil, avocados, raw seeds, and nuts. So you might be saying, well, why are the healthy fats so important? So if you remember a little while ago, I mentioned the liver and cholesterol. So our liver makes cholesterol, and cholesterol is so important for making our hormones. So we want to give the thyroid gland and our liver extreme healthy fats to be able to make the hormones it needs. Ocean vegetables, spirulina, chlorella, kelp, and nori, great for the thyroid gland and also for detoxification. Organic fruits, favor low sugar fruits such as berries and green apples, especially the berry family, your antioxidants, really key for your ACEs, A, C, E, selenium, and zinc. Selenium and zinc are really key for the thyroid gland. So antioxidants are key. Organic vegetables, all vegetables, especially the cruciferous family. Organic grass-fed and pasture-raised, chicken, turkey, beef, pork, lamb, bison, and other wild game. Probiotic foods, like I mentioned in the slide before, cultured vegetables, beet kvass, and kefir. and wild caught low mercury seafood. If you're wondering how to find out about the mercury content in your food, go to EWG.org, and they have a great seafood thing on their website that you can find out all the aspects of seafood that is safe and mercury content. So salmon, trout, sardines, clams, shrimp, crab, and scallops, those are the best low mercury seafood. So that's a summary of the good things to eat to support your thyroid. Wonderful, right? So if you're thinking like, okay, I might be having some thyroid issues or thyroid problems, but I'm not sure. So go to what you're eating first and bring in the things that support the thyroid and see if some of those symptoms or things you're feeling disappear. Okay, so what not to eat, right? I just gave you the good things first. So this is what not to eat. So caffeinated drinks, and my patients always frown at me when I say, to stop drinking coffee. Now this could be like coffee, like overload, right? Drinking more than 1 cup a day, for instance. But if caffeine affects you, you can also find that out with a genetic test. If caffeine really affects you, it will affect your adrenal glands and your thyroid will not be happy. Conventional meat, ones that have added hormones, alcoholic beverages, even one alcoholic beverage can mess with hormones. Sorry about there. If you're the one wine, glass per night. Now, I'm not saying there's a lot of benefits of drinking red wine. They've done a lot of studies with resveratrol, but you want to make sure that you're in balance. So your liver, which processes alcohol, can make the hormones it needs to from cholesterol. A conventional dairy is the #1 source of dietary estrogen. We don't want to have excess estrogen and going into estrogen dominance. Fast food, so high in sugar, salt, and chemicals. Gluten and processed grains. These have been shown, especially with AIP, autoimmune paleo diets. The thyroid is highly affected by grains. They cause pro-inflammatory and intestinal permeability, cause a lot of systemic inflammation in the gut. GMO foods, genetically modified, of course, don't buy those. Industrialized cooking oils, canola, corn, soy, and other vegetables. I recommend using avocado and maybe olive oil. There's been some new things coming out that the olive oil on the shelves is not very pure. So research that a little bit in your local environment or in your health. Processed food, no real nutritional value, of course, like when you're eating a box of, crackers or something. Refined sugar messes with the blood sugar, not good for the thyroid, for the adrenal system, which controls blood sugar balance. And stress and cortisol, right? Okay, so that's your nutrition piece. And now let's look at toxins and how the toxins in our environment are affecting the thyroid system. So the toxins disrupt your thyroid, right? And that makes sense, right? Because we saw in the beginning, if you came a little bit late for the presentation, I talked about in the beginning that every cell is affected and in relationship with the thyroid gland. So even without realizing it, we're exposed to thousands of toxins every day, and these are affecting our hormones, including the thyroid hormone. So I think this is one of the reasons why we're seeing a huge shift in the body's ability to have a better working thyroid, and we're seeing dysfunction there, and also with the other hormones, because we're having more toxins in our environment that we're having to process. It's like a toxic overload. So toxins are present in our foods we're eating, the cleaning products we use in our home, and many of beauty care products that we're using every day. These can really affect the thyroid gland. So over time, the damaging effects of toxins add up, and they can have a serious impact on our health and thyroid hormones. Okay, so how do we make a swish, right? So if you're thinking like, okay, I think I might have some toxic chemicals that I'm using. Maybe you have one, or maybe you have all of them, or maybe you have some cosmetics. What I recommend is taking one aspect of your products in your house and looking at them, making one switch at a time. Like I did in 2020, it was my goal to switch out everything to being plastic free. and also having like to make the lowest impact on the environment and on my body. So I did one thing at one like group at a time. So do the things in your house, do your cosmetics and fragrances, because if you're doing a lot at once, it can feel overwhelming. And here, the environmental working group website that I mentioned, EWG.org. This is where they have tons of great info. You can put in a product. Let's say you have a face cream and you want to put it in there and you want to find out the toxins. It'll show you what toxins are in there and what the toxicity level is. Okay. So that can be really important. There we go. Okay. So let's go to herbs and essential oils for thyroid health. So these are just some of my favorites that I recommend. There's so many that I use with patients, but these are my top ones that I wanted to give you today. So herbs. So ashwagandha, really an amazing adaptogen. It helps our body adapt to stress and wonderful for the thyroid gland. That is really key, especially right now during the pandemic and COVID, a wonderful support for the body. Bladder rack, a great herb to use, and coleus. So those are the three ones, and they different between ashwagandha is okay for hypo and hyper, but bladder rack and coleus, it really depends on if you're hypo or hyperthyroid. So you always want to check before using those. And then so if you're familiar with using essential oils, or if you're just starting, these are my favorite ones to use for the thyroid, especially frankincense. I would say that's my like number one go-to. I like to make it in a roll-on, or you can just add it to a carrier oil and apply it directly to the thyroid gland, because what that will do is it will decrease inflammation in the thyroid gland. So a really important one for hypo and hyperthyroidism, because in both ones, they're in an inflammatory state, right? And also in an autoimmune disease like Hashimoto's or Graves' disease. So ashwagandha, bladder rack, coleus, lemongrass, frankincense, and lavender. Wonderful ones to start bringing in slowly to support the thyroid, to empower you to take charge of your thyroid health. So lifestyle is key. Like I mentioned, stress, right? Let's talk about lifestyle. So living healthy with the thyroid in regards to your thyroid is not negotiable, right? This is really important because you have to go all in when it comes to thyroid health, because remember, it's affecting every cell of our body. So doing mindset, living a healthy lifestyle is really key to getting back on board with empowering our thyroid. So the right mindset is essential for optimal thyroid health, and your hormones are sensitive to shifts in your environment. Make time for self-care, really key. Running yourself into the ground with work won't do your thyroid any favors, right? You're just going to run on empty, and then your thyroid is going to react poorly because your adrenal system is going to be affecting the thyroid gland. Take walks, go to yoga, get a massage, relax on the patio, hang out with friends, and create a happy life with minimal stress and worry. Your thyroid is counting on you. This is if we take a look at that, really, that's not like super complicated, right? But our thyroid will thank us. It'll give us the like, yay, hand clap, right? Thank you, gratitude. Okay, that was a lot of wonderful information there for you. So just to recap, we talked about amazing herbs. We talked about nutrition. I also wanted to talk about some supplements here. And I'm going to go back and go to this screen here because I didn't mention them. And I want to go back to the testing screen, and because it has the supplements on them here. Okay, so I want to talk about the importance of your supplements in regards to the thyroid. And this is all in your handout too. I just didn't put all of the supplements on the slides here because there's a lot of different supplements. So the 10 main ones that I really recommend for the thyroid. So we have selenium, like I mentioned before. Selenium is essential when it comes to thyroid health. And that's over here. You can see zinc, selenium, and vitamin D. So this essential element, combines with other polypeptides to form the amino acid selenocysteine. And the thyroid has a particularly high concentration of proteins that contain this. So these proteins are required to convert T4, remember I talked about T4, into the more active T3. So selenium is really, really important. You can do a test for selenium, but it's been really shown to reduce thyroid antibodies. So I always bring it on when someone has autoimmune disease. So collagen is also really important for the thyroid gland. It's the most important abundant protein in the body, and it makes up our cartilage. It gives our skin the structure and elasticity that it needs. And it keeps our muscles happy, our muscle tissue. It keeps our nails strong and our hair. So two common symptoms that I mentioned earlier of hypothyroidism are brittle nails and hair thinning. So collagen is a key supplement to bring in for that. So iodine over here on the left bottom hand of the screen. So iodine is really important. It's one of our largest minerals in our body for synthesizing the thyroid hormone. Now, it's important to test your iodine levels. You can message me with I'll send the quick test how to do that. You can just use iodine tincture and you paint a little yellow square. It's super easy, but it's important. You paint it on your body. It's important to test this because you want to make sure that you're not giving yourself extra iodine that's not needed. In hypo and hyperthyroidism, really key. So because a high dosage of iodine can be very damaging and can send you into hyperthyroidism, very important to test. So that is an important. So far we've talked about selenium, collagen, iodine, now vitamin D3. So vitamin D3 is a fat soluble vitamin that your skin can produce when exposed to sunlight. So worldwide, we're seeing so many deficiencies in vitamin D, especially during the pandemic. People weren't spending enough time outside because they were quarantined or spending a lot of time outside because they were free, kind of like both sides, right? But people also that live in colder climates don't go outside as much. So getting enough vitamin D from your diet alone can be tricky. So supplements are often required and there's different levels. So I always recommend, like you can see here on the suggested laboratory test that vitamin D before supplementing. So in inositol, also known as vitamin B8, that's vitamin B as in boy 8. So it's not actually a vitamin, but it's a sugar molecule, and our bodies can synthesize inositol, and therefore it's not considered like a true vitamin, quote unquote, but inositol supplements can reduce levels of thyroid antibodies. Really important to bring in for Hashimoto's and Graves' disease. And you can take it with selenium. It makes a great combination. Okay, and then probiotics. So remember, I talked all about the gut health. So bringing in probiotics and digestive enzymes, really key for thyroid health. So the gut microbiome has a tremendous impact on the health, more than we had ever previously thought. We're learning a lot about the microbiome. It affects every single system in our body. So naturally, it affects the thyroid gland. So probiotics will lead to a healthy gut, which then, remember I said, leads or helps the thyroid hormone convert from T4 to the more active form of T3. And digestive enzymes. So digestive enzymes are necessary because they break down the food from the mouth through the digestive tract. They help us absorb nutrients and better nutrients from the food that we eat. Really key, because especially if you're taking a lot of supplements right now, or you're going to be taking supplements, if you're not taking that digestive enzyme to help your body to break down things you might not be assimilating or absorbing those supplements, you're basically just peeing and pooping them out. So that is your money and your health down the drain. So not a good idea. So enzymes will ensure that zinc, selenium, iodine, and the other nutrients are then absorbed and available for use. Another one is zinc. It's right here on this row here. Zinc. Zinc is an essential mineral, especially right now during COVID. Zinc and vitamin D and vitamin A, really key for the immune system. The zinc is an essential mineral that has many important functions in our body, including metabolism and supporting the immune system. So if you're having a problem with weight gain, right? You just can't get it to budge. It could be the thyroid. It can also be related to zinc. Zinc also plays an important role in thyroid hormone balance, and it lowers levels of cortisol, our stress hormone, which in turn balances the level of the thyroid hormone. So the other last piece of supplements is amino acids. So the amino acids, they're like our building blocks of the system, all the proteins in our body. And although our bodies can produce some, we have our essential amino acids, there are many amino acids are considered essential because we get them from the diet, right? That's our essential. The thyroid hormones are essentially made up of iodine that I mentioned and a specific amino acid known as tyrosine. So similar to an iodine deficiency, this can lead to thyroid problems. So a deficiency in tyrosine, although it's not as common, however, tyrosine is not the only amino acid that's necessary for thyroid health. There's other ones too. And other amino acids can indirectly improve thyroid function. So you could get an amino acid test. I didn't put that one on here, but that's one that could be run, especially if you're having a lot of problems with metabolism and weight. Okay, and then I mentioned ashwagandha earlier. Remember on this, let's go back to this slide. I want to say one more thing about ashwagandha, just because it's such an important herb in helping. Here it is right here. Herbs essential for thyroid health. So again, ashwagandha is often used to reduce feelings of stress and anxiety. So key right now. And it's an adaptation. It helps us to adapt to stress when we have a stressful environment or we're under a state of chronic stress. And studies have shown that taking ashwagandha supplements can improve levels of thyroid hormones and can restore normal functioning. So really key. You want to take it away from thyroid medication. So most of the time, if you're taking like levothyroxine, for example, for hypothyroidism, you take that in the morning away from food, your first thing. So you would want to take ashwagandha later in the afternoon or later, you can after you eat, okay? Not with food, but away from your thyroid medication. Okay, great. I wanted to get back to that. So wonderful. So we covered our supplements. We covered nutrition, foods you could eat. We covered herbs and essential oils and labs. So I hope that you feel empowered to take the steps for your thyroid health because it's really important, right? Our thyroid is a very, very, very important organ. So if you're ready to take your thyroid health to the next level, I have a wonderful new program. I'm launching my thyroid 30-day recovery program, and it is going to be amazing. So if you're exhausted, gaining weight, moody, you just plain feel like crap, you've been to all the doctors, you've been poked and prodded. Whoops. I'm going all over the place with the slides tonight. I'm sorry. Whoops. Okay. Sorry about that. Let me go back to here. Wow. Okay. Here we go. Okay, we're back on now. Now I got to go forward to it. Computers, at least it didn't shut off, everyone. I'm sorry. Okay. We were talking about my amazing new thyroid recovery program to help you get back on track with your thyroid gland, right? So like I was saying, you've been to so many doctors and nothing shifted. I hear this is probably one of the most common things I hear from patients. I have been to so many doctors to help with my thyroid and they just keep wanting to put me on different medications. I don't want to take medication. I want my thyroid to function, right? So the medicines and the treatments haven't done anything. You're not alone. Or also maybe you haven't been diagnosed properly. So what's included in this amazing program? You're going to get 2 thyroid recovery guides, my hormone reset and hormone mindset, Dr. Lulu's thyroid protocol. You'll get 1 30-minute visit with me to discuss recommendations and labs. That's key, like a huge part of to help you in your recovery. Recipe guides with meal plans and what to make to help support the thyroid nutritionally, a gratitude journal, and law of attraction planner. Remember, I talked about that key piece of the emotional component with the thyroid. So that's going to be a piece we're going to address when it comes to thyroid recovery, and weekly manifestation meditations. So that sounds amazing. I can't wait to take part in it. I'm super excited. And it's time to reclaim your health from your thyroid disease. Because I know that if you're attending this, either you or you're a family member or a friend, you're going to share this share this with today needs help. So the entire cost of the program is $299 for the 30 days, but bonus to all workshop attendees, you get $100 off the program plus my 5-week mindset reset course to really get you geared up to start. So you'll use coupon Thyroid Power, and I'm going to send it all out tomorrow. So make sure you get that in your inbox and sign up. And if you don't, just message me in lots of different ways. You can contact me at my email, or you can contact me on the website. You can send me a message, or you can send me a message on Instagram. Lots of different ways you can find me and contact me. I'm here to support you in your thyroid health. So that ends our webinar this evening. And I hope you enjoyed and you learned a ton.